Before a treatment, I actually use pressure points.
Okay.
So I'm going to ask you to bend your knees. Just let me know if I press too hard. This actually helps. What it helps is the ileocecal valve that separates your small intestine from your large intestine.
Okay.
It actually tells me, it helps it relax so we can get a good release.
Okay.
And it actually shows me, I can actually feel it if it is actually contracting and relaxing appropriately, because that is the closed part of the colon.
Okay.
Whereas the other valve, the one at your rectum, the Houston valve, is actually 3 or 4 little flaps that don't actually close. I really like to kind of amplify what the body is able to do and allow it to do it.
And what is all of this? The same?
These are just the pressure points.
Okay.
Now I am going to take a peek at your belly. Okay, so now we're going to insert. So I'm going to ask you to turn over onto your left side. Bring your right knee down onto the table in front of your left knee. This is usually the most comfortable position for insertion.
Okay.
Insertion will feel a little weird.
Okay.
Okay, I can't tell you that it won't.
Okay.
But when the water does go in, the nice warm water, it does seem to fade that feeling.
Okay. Thank you.
So I'm just going to hook up to the machine, and the water will be nice and warm, so it'll be very comfortable. Now, as I said, I use a lot of lubrication,
Okay.
just for your comfort.
Okay.
Okay. Now, I'm going to insert it. I'm going to ask you to breathe in really slowly, and then as you exhale, I'm going to insert.
Okay.
Okay, so that's your cue that I'm going to insert. So I'm just going to lubricate the area.
Okay.
Okay. Big breath in. Long breath out. Okay. Feels very weird.
Feels very weird.
Yeah.
But not painful.
Painful. No. Now I'm just going to turn on the water. Good. Now I'm going to just drape you nicely, so you won't be cold either. Okay. So now that we've got you all set up, I'm just going to do 3 short fills while you're on your side. One for 5 seconds, one for 10 seconds, and one for 15, just to prepare your colon.
And what's a fill?
I'm going to hold water inside your colon.
Okay.
If it's not tolerable, let me know and I will release.
Okay.
Okay, but we're just going to get your colon used to what we're about to do.
Okay.
And if you'd like to do something to help, what I would suggest you do is breathe in through your nose for
Okay.
6 slow beats and then out through your mouth for 6 slow beats.
Okay.
That'll actually really help relax that colon muscle.
Okay.
So I'm going to start your first fill now for 5 seconds. Good. Perfect. I'm going to do the second fill, a little bit longer. Good. Oh, you've already given us treats. Yay, perfect. And we'll do the third one. Good. Now, how did that feel?
Not bad.
Not bad. Okay.
No.
It was tolerable?
It was.
Now, the other thing that you're going to feel for me is I'm going to compress the tube like this. Can you feel that?
Yes, a little bit.
Is that tolerable?
Yep.
Okay. Now I'm going to do that for a couple of reasons. One, your colon's not contracting in a regular rhythm. Your colon is meant to contract in peristalsis.
What does that mean?
It means contraction, release,
Okay.
and it allows it to push the stool out. I'm not feeling that being done on a regular basis, so I'm going to encourage that motion, and I'm also going to encourage as much stool and gas out as I can.
Okay.
Okay, so we'll do that throughout. And you're releasing gas already. Very bubbly.
And you can't hear it, which
Nope.
is nice.
No, you
Or
can't
smell it,
hear
which
it.
is nice.
No, you can't smell it. So now, I'd like you to decide something for me. Would you like to stay on your side the way you are, or would you feel more comfortable on your back? Either is fine, I just want you comfortable.
Maybe on my back, as long as it is okay to do so.
Okay. What I want you to do is turn over, find a comfortable spot.
Okay.
I'm just going to make sure everything stays in place here.
And it won't hurt the tube, or?
Nope. Nope. I'm going to get you to keep your knees bent though.
Okay.
You can go all the way on your side, or on your back.
Okay. Oh, okay.
There we go. How's that?
Okay.
So far so good?
Mm-hmm.
I like it better this way. I
Yeah.
keep looking in
Yes.
the eyes.
Yes.
Which is much nicer. But if you're much more comfortable on the side, we'll turn you back.
I'm okay.
And now is the time where I put you to work.
Okay.
Now, this time when I do a fill, when I hold water in your abdomen,
Mhm.
I'm going to get you to tell me when you want to release.
Okay.
That is when that you feel crampy,
Okay.
you feel pressure.
Okay.
Okay? A little bit is okay, a lot is not.
Okay.
We do not go to the point of pain.
Okay.
Okay, so I need you to clearly communicate with me, alright?
Okay.
Now, I do have a pressure gauge on my machine
Mhm.
that will tell me if we are going into a red zone,
Okay.
and I will release it anyway.
Okay.
Okay, but I'd much rather cater to you and what your colon is doing than my beautiful machine.
I appreciate that. Thank you.
Alright, so again, if you want to help, I would go to that beautiful slow breath.
Okay.
And I'm going to start the film now.
Okay.
Alright, and you let me know when you want to release.
Maybe now. Is that okay?
Absolutely. I find the more that we kind of cater to where your colon is at,
Mhm.
the better and more effective he works.
Okay.
So as long as we're making decisions on how you feel, then I think we're doing the right thing. So how does your abdomen feel right now?
Maybe slightly crampy.
Mm-hmm. Absolutely.
It just feels different. I don't know. It's not, I don't know, it's not painful, it's not necessarily uncomfortable, it's just
Different.
different.
Mhm. And that is a usual experience during a first colonic,
Okay.
because we're very good at stopping to listen to our colon.
Okay.
Our colon is very adept at telling us what it needs and what it wants, but we tend not to listen. We hold in gas and we decide to wait a few hours till we get home to have our bowel movement.
Right.
You know, things like that, and it gets a little ignored.
Okay.
So now we're retraining ourselves to listen to how he's feeling.
Okay.
And that's all we're doing. Do you still feel a little crampy?
No, it actually feels better.
Good. I'd like to do another fill.
Okay.
Again on your call.
Okay.
What are you feeling when you want to release?
Cramping.
Is it all over your abdomen, or is it just in the left lower side?
It's just in the left lower side. Why would you know that specifically? How did you know that it would specifically be there?
Well, sometimes when this happens, you can have a collection of stool that wants to be released in that lower portion. That's just the portion just above where the rectum is, and that's probably where you feel the most pressure.
You know what? I'm learning so much about the things that are going on exclusively on my left side here at Bodystream. I can't even tell you. And you know what? Now that you say it, I'm not necessarily surprised that you knew exactly that it would be on my left lower side.
Yes, we do things a little differently here at Bodystream.
But I like it, and it's just I'm having so many connections all the time, and I don't know, it's very cool.
It's fun.
Yeah.
So it's always good to let me know of any changes in the rest of your body as well.
Okay.
Because sometimes your anatomic nervous system can kick in, and you can actually feel tingles in your hands and your feet.
Oh.
Or you can feel a little nauseous. Or you can even feel a little lightheaded. But I don't encourage you to do that.
No, I don't feel any of those things.
Perfect. Are you feeling any cramping?
No, and this is so bizarre, but I'm feeling oddly relaxed. And I don't know how that's possible in this given situation, but I do.
Well, that's good, because you do release better when you feel relaxed. I find the colon is, well, in my opinion, the most emotional organ. So if you're upset or you're afraid or fearful in any way, your colon actually tightens up and makes it harder for it to work. And when you're relaxed, which is what I really try to make sure people who come in here get to be, it's much easier to release and improve the function of your colon.
Well, you're doing a good job, and quite relaxed. Now, is my colon still not doing as it should on its own, or is this something that you typically do, this handling and manipulation of the tube?
Normally for the people I see, they require it, but
Okay.
if a good functioning colon actually has a very constant peristalsis, and it's very effective by itself. So I just tend to do what the colon tells. Alright, I would like to do another fill if you're comfortable.
Sure.
Alright, so nice slow deep breaths, and on your call.
I think that's good.
And then pop some more stool. Beautiful.
So is there lots of stool coming out, or?
Just a little bit right now.
Yeah.
When you have a bowel movement, what is your normal size?
I have explosive diarrhea.
There you go.
Yes.
Oh dear.
All the time. It's either that or constipation. There is very rarely an in-between, which is another reason why I'm excited to do this. Sometimes it's thin, sometimes it always sits on top of the water. It's foul smelling. I know that it's been my normal for so long that, to be honest, I don't even know what a fully formed stool looks like or should look like, which probably isn't very good that that's my normal, I'm thinking.
Well, I'm very glad you're here. This is something we can definitely work on together.
Perfect. And one thing that I have, since I've been at Bodystream, I have been making changes to my diet in a very good way. And, you know, being on the intensive probiotic and now the clove and stuff like that, I am noticing, because sometimes it would be 2 or 3 days that I wouldn't have a movement, and now I seem to be more regular, although it still isn't looking as it should. I feel better. I have less gas and less bloating, and yeah, so I am making changes towards feeling better that way.
Diet is very important.
Mm-hmm. I'm learning that.
I find it's not just one thing that's going to help you be healthy. It is different eating, exercise, your mind.
Mm-hmm.
It's never just one thing. I'm not real big on diets.
Right.
I'm really big on lifestyle. Andrea, you say that, and that is another light bulb, because when I started working here, I thought, great, I'll go on the HCG diet and lose lots of weight and that type of thing. And you know what? I've actually lost 7 pounds since I've been here from making simple changes that have, you know, drinking more water for one, and not focusing on diet, and not focusing on, and learning more about what foods are good for me, and when to eat them and how to eat them. And do you know what I mean? Like, the lifestyle versus diet thing is huge. Like, I have a new way of looking at what I put into my body, you know, as opposed to filling it for, you know, because I'm bored, because I'm, you know, emotional, because I'm whatever, to fueling it to work better. And that's, like, that is lifestyle. And I'm able to, you know, as making changes, positive changes for my family as well. And I love learning. I love how much I'm learning here. It's very cool. It is very cool to work here. I've actually been on the HCG diet because I was very heavy, and it's taken me a long time to get to this point where I understand it's more lifestyle than diet. And the HCG diet actually taught me that in a very strange way.
I love that.
I know, it's learning. That's all it is. Now, are you feeling crampy? Because I'd like to do a fill.
No, I'm good.
All right. On your call. That's good. Perfect. And we got more small pieces of stool. I'm doing beautifully. Thank you, silly.
Is there anything that stands out in what you see coming out, or?
Looking at what I see now, this is very initial stages, but I would definitely encourage you to increase your water intake.
More? I'm trying. Andrea, I before I started working at Body, I did not drink water. I drank coffee and pop. I know. I am really trying to increase it. I will have a liter. I have had up to 2 liters. I know that I consistently need to drink more water. And I'm even trying to have my jug of water next to my coffee. I have 2, and I know, I have 2 coffees. I've started putting chaga into my coffee.
Have you?
Yes, to make my coffee more
Actually, a lot of people are replacing the coffee with the chaga, and they're finding it just great.
I know.
I was never a big coffee drinker, so
Oh.
but people are just able to replace it with it, and it's so much healthier.
It's the only thing that I would be willing to replace my coffee with is the chaga. It is. It's hearty and bold, and it's similar to a coffee. I would not associate it with a tea or anything. It is quite hearty and yes, but I will drink more water. So Krista, the naturopath, said that I should be drinking, based on my weight, about 3 liters a day. The thought of that makes me feel waterlogged, even thinking about it. So is there a system that would, I don't like water. I do, and I'm on drinking the alkaline water as well, which I do find is helping with my cravings and my eating and everything. But is there a way to get it in you, that you can do by time or by, do you know what I mean? Just so that at the end of the day, I'm not trying to chug down a bunch of water and then being up all night with having to go to the bathroom.
Well, I try to get most of my water in before 6 o'clock, because sometimes you are up in the middle of the night, and I prefer to sleep, so.
Yes.
What I tend to do is I have my big water bottle,
Mm-hmm.
and I know how many I like to get in a day, but if you want to try increasing it, I wouldn't try to increasing it like to 4 liters immediately.
Okay.
I would, if you're up to 3 liters and you're comfortable there.
I'm not.
Okay, when you're comfortable there.
Okay.
Find a place where you're comfortable. Okay?
Okay.
And then I would increase by a 1/4 cup each day.
Oh.
So if you need to sit at, 2 liters and a 1/4 cup for a week, then sit there.
Okay.
And then move up when you're comfortable.
That's a baby step, and I like that.
Yeah, it's a baby step, and it allows you just to take the time
Okay.
to let you get used to it and your body get used to it.
Okay.
I mean, I'd love it if we could change everything overnight for people, but sometimes it just takes time and consistency. May I do another fill?
Certainly.
On your call? Okay.
I think that's good.
Some more small pieces. And lots of little bubbles of gas.
So the small pieces is that, and that's what my stool looks like in the toilet. Is that, does that make sense that that's how it's coming out here as well?
Sometimes you'll have different releases. Sometimes will be a little looser, sometimes won't be. Sometimes will be larger pieces in the tube. It just depends on what's in there and what's able to come out.
Okay.
So I'm always happy when we have release, because sometimes you have good release in here, you sometimes have good release in the bathroom, sometimes you have both.
Okay.
And I'm happy because we are exercising your colon so that it works more effectively when you're at home,
Okay.
not just when you're here.
Okay.
We can have fun while you're here,
Right.
but I want you to do better at home.
Okay. Is there any kind of, and this again might not make sense, but is there any kind of exercise that I can do to stimulate my colon working better? Like similar, I guess, to a Kegel, but not the same as?
Well, the colon is a muscle, but it's not a voluntary muscle. So
Oh.
there's nothing you can actually do to make it flex,
Oh.
except clean it out.
Oh.
Now, there are a couple things I like to suggest just, to make it easier for your colon to work.
Mm-hmm.
I like to encourage people to do the deep breathing exercises at least once or twice a day, or if they're anxious, so slowing down your breath, like that slow breath that I've encouraged you to do.
Mm-hmm.
That helps reduce anxiety.
Okay.
I also, if you're having a lot of trouble, I actually encourage you to extend your arms up to the ceiling.
Okay.
Even when you're having a bowel movement.
Okay.
Because it actually lifts up your lungs and your ribs and everything. It allows more room in there.
Oh.
Because sometimes what happens when you're constipated, it actually can push upwards, it can push to the sides, it can push to your back, causing back pain. It's very uncomfortable. So if you actually raise up your body and give it more room, it can function better.
That's good to know.
It's one easy thing you could do.
Okay.
And the other thing I encourage you to do is work on your core. When I ask you to go into the bathroom, when you feel you're done, I ask you to do the hula hoop 10 times and then sit back down.
Okay.
And that way, if there is anything left inside you, you can do it in the bathroom and not on our stairs.
Oh, I appreciate that. And so will you, and so will everyone else in the building. Oh, that's funny.
But yes, moving your abdomen around and getting all those muscles working
Okay.
does help as well.
Oh.
So I do suggest working on your core somewhat.
Okay. That doesn't hurt for multitude of reasons, I guess.
May I do another fill
Certainly.
on your call? I think that's good.
So in each fill, roughly how much water?
It's-
In liters or something?
It's hard to tell, but on average, I'm not real good with liters, but
Oh, neither
I
am
work
I.
in gallons.
Okay.
And you can have anywhere from a gallon to about 10 gallons for the whole session.
Oh, okay. And where am I at?
Well,
roughly?
I don't know.
Okay.
I don't actually measure the water.
Okay.
It's a closed system, so we're not actually able to see that.
Oh, that makes sense.
And one question that I do seem to get is whether or not I can take a stool sample, and I can't because it is a closed system.
Oh, right. But the benefit of having a closed system is it prevents bacteria spread. And
Exactly, and I think that's most important.
I agree. Yes, I would much rather be in a sanitary environment and have my stool sample taken in a different location than mixing the two.
How's your abdomen feeling?
Good.
Good.
A little gassy, but I don't know, does it make sense to feel like less full? Like less?
It can, because you're actually giving me quite a bit of gas, and you've released some stool, so you are less full.
Good.
Sometimes during the first colonic it's not as easy to relax, and we have a little added extra. So sometimes it does take a little longer for you to release.
Okay.
But normally we're able to see some good things.
Okay. And have you been able to see any of the parasites or anything, or?
No, I haven't
Good.
seen any parasites.
Good.
I definitely like to let you know because that's something that we can do something about.
Okay. Good. So what would you do if you could see them?
Well, me, I'd probably say cool.
Yeah, sure.
And then I'd probably turn to you and in a straight face let you know very compassionately that you do have parasites.
Mm-hmm.
And there are a lot of options that we can talk about that can actually help you rid yourself of them.
Okay.
Now you are starting to release a little heavier. You may feel a little different.
I feel a little bit of pressure.
Mhm.
More like how I would typically feel in having to go to the bathroom.
Mhm. That was a little nicer release. You're getting some discoloration of the water, so we're really kind of soaking the insides of your colon right now, which is very good.
Oh, good.
Do you feel crampy now?
I did a few seconds ago, but I think it's
How about we
good.
do another fill?
Sure.
On your call?
Okay. I think that's good.
Lots more gas. Some small pieces of stool. We're getting some larger pockets of gas. How are you doing? Good. I do encourage you not to answer the phone during a clinic. I do tend to need you.
Yes. I apologize. I forgot to turn my ring on.
No worries. Sometimes I do have the CV on. Although it's not normal type, thank you.
You know what? I love this groove. It's Ace Frehley's New York groove. It's just so cool. I love it every time I hear it.
Now, if you feel like you're getting a little stiff, you are more than welcome to wiggle your toes or your fingers. Okay, sometimes that does help. That was a lovely sound.
I heard that, yes.
Beautiful. Your colon is meant to make sounds. It's a very good thing.
Okay.
It means it's moving.
Oh, okay.
And we want our colons to move. That's its primary function.
It's so hard, and I'm a person who has a lot of gas, and I think a lot of that is getting better, and I think a lot of it before was based on diet, but it's so hard because you don't feel comfortable releasing when you are in public. So, you know, when you said before about listening to your colon and, you know, when it makes sounds to release it, and or, you know, having to hold so that you can get home and go to the washroom and stuff, like it isn't good because you're creating, you're overriding its natural system, it almost seems like.
You're ignoring your colon.
Mm-hmm.
And colons really don't like to be ignored.
No. So would this be something good as a preventative measure for colon cancer? Or is that related?
Well, it's not proven
Mm-hmm.
to prevent colon cancer. But what I believe is that if you have a colon that's functioning well,
Mm-hmm.
it can prevent it itself.
I think that makes sense.
Yeah. I would like to do another fill
Okay.
on your call. Okay.
I think that's good.
Do you ever put lemon in your water?
No.
No? I might suggest that when you first rise in the morning,
Mm-hmm.
that you have 1 glass of water, preferably 8 ounces,
Okay.
and put a half a lemon in it, and it'll actually help prepare you for the day for your colon.
Oh, really?
Yeah.
What is the significance of the lemon?
It basically just sets your colon up for the day
Okay.
and allows it to function better.
Hmm.
I always find that even starting your day with a glass of water, but I find when you have colons that are a little unhappy, the
Mhm.
lemon adds extra support.
Okay. Can it be lemon juice, or can, like, from the, the little lemon thing that you buy, or should it be from a fresh lemon?
I prefer from a fresh lemon.
Okay.
Organic is best,
Okay.
but as long as there's nothing added to it.
Mm-hmm.
Okay.
You know what, that is something that I can commit to, because I, what's it called? Sequoia?
Mhm.
I'm taking that. It also needs to be taken with water, so I can have that and then commit to my little lemon drink as well. I will
Perfect.
commit to that, Andrea, starting tomorrow.
Awesome, and you are releasing nicely again.
Do I chew my food well?
Sometimes.
Oh, depends on if it's really good or not.
Yes. I am seeing some small particles of undigested food.
And what does that mean?
Just means they're not breaking down as well as they could.
And why would that be?
Well, it could be that that you're not chewing, you're rushing your meals, you're inhaling it, because actually chewing does more than just break down your food. It actually activates enzymes,
Mm-hmm.
which help you metabolize, but your body may not be able to metabolize, because sometimes with chronic conditions, your energy is just basically going elsewhere. Okay, so it's good to look at underlying issues as well. Or you may just not be making enough enzyme to actually help your body break down your food as well.
Okay.
And we're going to continue to release beautifully.
Krista had mentioned about leaky gut as well. Does
Mhm.
that make sense then, for not being able to?
Yes, it does.
Okay.
And again, that's just a healing as well. Beautiful. I'm just looking excitedly for parasites, but not finding any. But that does not mean you don't have them, because most parasites are microscopic.
Right.
And I do not have the benefit of that type of seeing. How's your abdomen right now?
I'm a little gassy, I guess.
I am stirring things up in there, so
Okay.
that's my fault. I'm doing it on purpose.
Okay.
And again, it's all going out my beautiful tube.
Better out than in.
Absolutely, one wise green man once said. You're a wanted woman. You're almost,
Is it dinner time? That's why I have teenage boys and a husband. And I did not tell them what was on the menu for tonight.
No. Uh-oh. Well, we are going to finish up shortly.
Okay.
Because again, I don't want to work you too much.
Okay.
We did release rather nicely. We got some hard stuff in the beginning.
Okay.
And we had some looser stuff as well. Again, no parasites that I could see.
Good.
So yes, I would encourage you to chew your food just a wee bit more if you're able.
Mm-hmm.
I don't know if you're used to inhaling your food.
It depends on the food. It really does.
Alright, so I'm going to turn you over on your left-hand side.
Okay.
We'll remove the speculum.
Okay.
I'll encourage you to go into the bathroom. I
Mhm.
want you to take your time.
Okay.
Use your breathing. If you're feeling a little bit uncomfortable, you
Mhm.
can try raising up your arms like
Okay.
we talked about.
Yep.
When you feel you're done, I want you to stand up, do the hula 10
Okay.
times, and then sit back down.
Okay.
Okay? You may or may not have more release. I have a feeling you will.
Okay.
Okay? It could be stool, it could be gas, it could be just water.
Mm-hmm.
Just let it go. Okay? Whatever your colon wants to do, that's what we'll do.
Okay.
Okay?
Yep.
So I'm going to turn off the water now so I don't give you a shower.
Thank you.
And we will maybe take a little break.